The broadcast is now starting. All attendees are in listen-only mode.
Hello, my name is Mike Willett with the National Native Network, a program of the Intertribal Council of Michigan. Welcome to the NNN webinar series on cancer risk reduction in Indian Country. This webinar is titled Using Campaigns and Social Media to Address Commercial Tobacco Use. This technical assistance webinar is being hosted by the National Native Network with Indian Health Service, Health Promotion and Disease Prevention, which offers technical assistance and resources for commercial tobacco and cancer prevention and control throughout Indian Country, and the Indian Health Service Clinical Support Center. Your presenters today are Alberta Becenti, MPH, and Michelle Johns, MA, MPH. Alberta Becenti received her MPH in Health Behavior from University of Oklahoma and her Bachelor's in Health Education from the University of Utah. She's a public health advisor for the Indian Health Service. Alberta Becenti is the Public Health Advisor for the Health Promotion Disease Prevention Program for the IHS headquarters in Rockville, Maryland. She works with 11 IHS area HPDP coordinators to plan and implement activities focusing on obesity, tobacco, and cancer prevention in the community, clinic, school, and worksite. She has worked in the field of health promotion and wellness for more than 20 years. Michelle Johns is the public health educator for CDC's Office on Smoking and Health in the Health Communications branch. She received her master's in communications studies from New Mexico State University and her MPH in public health from New Mexico State University. She also received her bachelor's in communications studies from New Mexico State University. She has served as a public health educator within the Centers for Disease Control and Prevention's Office on Smoking and Health, Health Communications branch for 20 years. She is the cultural communications subject matter expert and a lead for custom communication technical assistance, and serves as a champion for culturally responsive practices among awardees, partners, and tribal populations in order to reduce health disparities and promote health equity. Most notable is her work on the National Tobacco Education Campaign entitled Tips from Former Smokers, resulting in over 9 million quit attempts since 2012, and over 500,000 smokers who have quit for good. No commercial interest support was used to fund this activity. This activity is designated one contact hour for nurses and physicians. To obtain a certificate of continuing education, you must be registered for the course, participate in the webinar in its entirety, and submit a completed post-webinar survey. We will be sending out a follow-up link tomorrow, within 1 hour of the webinar today, with a link to the evaluation for the survey. By the end of this webinar, participants will be able to identify smoking prevention and cessation campaigns that can be adapted for American Indian and Alaska Native populations, enlist available resources to increase awareness about the negative health effects of commercial tobacco use and exposed to secondhand smoke, and educate patients and community on the Smokefree.TXT messaging program that provides 24/7 encouragement, advice, and tips to quit. And now at this time, I am turning it over to Alberta Becenti.
Thank you, Mike. This is an outline of my presentation. First, I'll go ahead and kind of set the stage to give the background and then the current commercial tobacco use among Americans in comparison to the U.S. population, and then go talk about the health effects of commercial tobacco use and some of the collaborative approaches with key partners throughout the country in order to address tobacco use, And then the specific campaigns that was developed with Indian Health Service Health Promotion Program. And then also talk about the smoke-free text messaging. First of all, just want to cover the background. Smoking is the single most preventable cause of death in the U.S. And each year, approximately 480,000 people in the U.S. die from smoking-related illnesses. An estimated 41,000 of these smoking-related deaths are a result of exposure to secondhand smoke. And smoking has been estimated to cost the United States $300 billion per year, of which $107 billion in direct medical costs and $156 billion in lost productivity each year. Cardiovascular disease is the leading cause of death among American Indian and Alaska Natives. Lung cancer is the leading cause of cancer deaths among American Indian and Alaska Natives. Diabetes is the fourth leading cause of death among American Indian, and the risk of developing diabetes is 30 to 40% higher for smokers than non-smokers. And the risk factors that contribute to the diseases are commercial tobacco use and exposure to secondhand smoke. Mike, I don't see the arrow. They can go take me back. Okay. There. Thank you. Oops. When you look at looking at the data among American Indian and Alaska Natives, they have a higher prevalence of current smoking than most other racial and ethnic groups in the U.S. Factors that may affect smoking prevalence include sacred tobacco's ceremonial, religious, and medicinal roles in Native culture, which may affect attitudes, beliefs, and behaviors toward commercial tobacco use. Also, tobacco sold on tribal lands is typically not subject to state and national taxes, which reduces costs. Lower prices are connected to increased smoking tobacco. As you look at this slide, an estimated 34.3 million people, or 14% of all adults who are age 18 and older in the U.S. smoke cigarettes. In comparison to American Indian, Alaska Native in the U.S., which is at 24%. Looking at regional data on cigarette smoking prevalence among American Indian adults by gender, you'll notice that the Northern Plains for both male and female is higher in comparison to the other regions. Alaska males also hover near the same percentage of the Northern Plains. When you look at this regional data, you'll notice that the Southwest region has the lowest tobacco use, but keep in mind that the tobacco use among both male and female in the Southwest is higher than the national average. What is concerning is smoking during pregnancy among American Indian and Alaskan women. This slide indicates that American Indian, Alaska Native smoking during pregnancy is higher than other ethnic groups. It is very important to target prevention efforts towards women of childbearing years and to screen them for tobacco use and refer them to appropriate tobacco cessation services. E-cigarette use is also concerning. When you look, current e-cigarette use was higher among non-Hispanic American Indian Alaska Native adults, which is at 10.7% in comparison to other ethnic groups, which is lower. When traditional tobacco use for sacred or ceremonial tobacco use, which is the use of tobacco plants cultivated or collected in the wild by American Indian Alaska Native tribes for religious ceremonial tobacco are medicinal purposes, whereas commercial tobacco use refers to the repeated consumption of chemically altered nicotine-containing products such as cigarettes, cigars, pipes, tobacco, snuff, chew that have been cultivated, cured, or manufactured and sold by large corporations. Traditional tobacco is used for many purposes, and some of that may actually have been used by American Indian and Alaska Native tribes for centuries, either for medicine or for ceremonial purposes. Ceremonial tobacco use also varies greatly among tribes, and the traditional tobacco that is used for the ceremony or spiritual use is also diverse. Traditional or ceremonial tobacco use occurs in a variety of forms. Tobacco can be offered as a gift to the Creator or a gift to honor someone. It can be burned in a pipe, dish, shell, or fire with the smoke believed to carry prayers to the Creator. Therefore, traditional tobacco can be either smoked or used in a way that does not involve any form of smoking. The frequency of traditional tobacco use also differs across individuals and tribes, with some American Indians using traditional tobacco daily and others on special occasions. Some tribes have sacred tobacco stories of how it prepared, grown, cared for, harvested, and used for specific purposes. Many indigenous nations have traditional stories of how tobacco was introduced to their communities. Many stories emphasize the sacredness of the plant and its power to both heal if used properly and to harm us if used improperly. Some say that the original tobacco was discovered about 18,000 years ago. Ingredients also vary by tribes. Some tribes use sweetgrass, sage, red cedar, and blending of plants that does not contain nicotine. I'm from the Navajo tribe, and then with my tribe, they used a mountain medicine, which is a special plant that is that is grown in the wild. What are the impacts of tobacco use on health? Tobacco use accounts for at least 30% of all cancer deaths, causing 87% of lung cancer deaths in men and 70% of lung cancer deaths in the women in the U.S. Cigarette smoking, hang on, for some reason it's advancing forward. Sorry about this. Cigarette smoking also influences other cardiovascular risk factors such as glucose intolerance and low serum levels of high-density protein cholesterol, which is their HDL. However, studies have reported that smoking increased the risk of cardiovascular disease beyond the effects of smoking on other risk factors. In other words, the risk attributable to smoking persisted even when adjustments were made for differences between persons who smoke and non-smokers and levels of these other risks. Beyond its status as an independent risk factor, smoking appears to have a multiple interaction with the other major risk factors for cardiovascular disease, such as high serum levels of lipids and untreated hypertension and diabetes. Others include lung disease, emphysema, chronic obstructive pulmonary disease, which is COPD, and gum disease are other risk factors as well. Smoking, smoking and diabetes. Remember that diabetes is the fourth leading cause of death among American Indian Alaska Native. So we now know that smoking causes type 2 diabetes. In fact, smokers are 40% more likely to develop type 2 diabetes than non-smokers. And people with diabetes who smoke are more or less likely than non-smokers to have trouble with insulin dosing and with controlling their disease. No matter what type of diabetes a person has, smoking makes it harder to control it. Smokers with diabetes have higher risk for serious complications that include heart and kidney disease, poor blood flow in the legs and feet that can lead to infections, ulcers, and possible amputation. Retinopathy, which is an eye disease that causes blindness. Peripheral neuropathy, which is the damage to the nerves of the arms and legs that may cause numbness, pain, weakness, and poor coordination. And people with diabetes who quit usually have better control of their blood sugar levels. Secondhand smoke also has impact on health. It has been linked to health concerns, especially in asthma, infant death syndrome, respiratory infection, and ear infection. So now we know about the health impact of commercial tobacco products and then the extent of commercial tobacco use among American Indian, Alaska Native tribes. What are we doing about it? So in order to address tobacco use, we brought many partners together back in 2017 which included key partners from IHS, tribes, urban Indian Health Service, and state health departments, nonprofit organization, and other stakeholders to come together to learn about what are some of the effective strategies that have been implemented in American Indian, Alaska Native population, or what has been deemed effective among the general population that can be adapted for American Indian population. So we held this 2-day meeting. We brought together all these partners, and the first day focused on, what are the current best and promising practices that are being implemented in American Indian, Alaska Native population. The partners included Clearway, Minnesota Department of Health, the American Indian Cancer Foundation, stories from the field from across the country. What are some of the effective strategies that are implemented? What are some of the ineffective strategies that were used? And then also, what are the traditional movement on tobacco? On the second day, we focused on, as a group, we focused on developing a vision and a mission. Our vision was to keep tobacco sacred, honoring our indigenous lifeways, and our mission is by honoring our legacy of traditional tobacco, we see generations commercial tobacco free by sharing our culture, tradition, and teaching among all the indigenous people. So on the second day, the group decided, based on the lessons learned on best and promising practices from the day before, the group identified what are some of the strategies that we should be using in order to address commercial tobacco use. So what emerged during the second day meeting was that we need to focus on policies, coalition building, youth advocacy, traditional tobacco, media and campaigns, and tobacco cessation. As a result of that, we developed a national blueprint with all the partners, the area health promotion coordinators, the health education and other partners, and our collaborative partners, which includes the American Heart Association, American Lung Cancer Association, American Cancer Society, State Health Department, the Tribal Health Organization, and other key partners were identified to develop a national blueprint focusing on the 6 strategies that were identified by the group. And this afternoon, of course, I'm talking about the media campaign. And each of the area coordinators went back to their site to work with their tribes, IHS, and urban programs, and other essential partners to develop a plan focused on one of these strategies or multiple strategies or all 6 strategies, and to develop an evaluation plan and to implement it and to be able to monitor it. what we hope to do is we hope to come back together in a year or two to hear what are some of the best promising practices, what are some of the lessons learned as a result of this national blueprint. So that brings us to IHS. IHS actually hired a contractor to develop a campaign based on the feedback from the national blueprint with all the partners. There was infographics that were developed on cigarette use, adult cigarette use, and then also chewing tobacco. With some of these materials were actually field tested out into field to make sure the information meets literacy. It's appealing as far as, and then formatting as well, and it's easy to understand. And then also, what are some of the strategies that we should encourage the public to use? And then also, if anybody is needing help, if they're current smokers, where can they seek the information? Where can they seek services or for tobacco cessation services? It includes posters for both adult and children, and also develop an e-toolkit about an e-cigarette, and then also digital stories of former tobacco users. How some of these former tobacco users were successful in quitting tobacco use. All this tobacco prevention campaign will be rolled out sometime this month. If it's not this month, early next month. So all the materials will be available on the site to download, to print, and then to be able to also use the digital stories as well. The other effort is IHS partnered with the National Cancer Institute to customize the smoke-free text messaging for American Indian and Alaska Native. This also will be rolled out at the same time as the tobacco prevention campaign. The text messaging has been customized for American Indian and Alaska Native population, and so this is a 24-hour text messaging that's available, that will become available, and for a tobacco user who can be able to go opt in into the text messaging program, signing up, and it's a 6-week program. On a daily basis, you will be receiving messages about how to stay motivated and some tips throughout the duration of the 6 weeks program. And what's coming up is we're also developing a cancer prevention campaign to include infographics, posters, and digital stories of cancer survivors. So be on the lookout in the future. And this is my information. If you should have any questions, you can reach me and email me at this contact information. Thank you, and I will turn it over to Michelle.
Thank you so much. Let me see if I've got the availability to, yes, I do, to get my slides forward. Hello, everyone. Good afternoon or morning, depending on where you're living. I'm Michelle Johns from CDC's Office on Smoking and Health, and I am going to basically pick up where Alberta left off. I'm not going to give too much of an overview about commercial tobacco use, but more of some of the communication initiatives that we're using and ways that you all can plug in. So I wanted to remind you all that when CDC refers to tobacco, we are talking about commercial and not the traditional use, as Alberta was distinguishing the two. I also wanted to show you an infographic that kind of describes what Alberta was saying at the beginning when she was talking about the commercial tobacco use being the leading preventable cause of death and disease. So this kind of shows, and one thing that we didn't hear about yet that I wanted to highlight is that for every one smoking-related death, at least 30 people live with a serious smoking-related illness. So that's been a big part of our Tips from Former Smokers campaign, is when we did the focus groups, we found that our participants weren't so much afraid of dying, but living with an injury. And for everyone that dies, 30 are living with an injury. So that was an important message for us. All right, so here's some information about our 2019 TIPS campaign. One of our participants this year happens to be Leonard Nimoy and his family. His family reached out to us, and as you may know, Leonard Nimoy made a big impact on the stage and on TV, and his role in Star Trek and other theatrical roles. And his family really has come alongside of us this year to tell his story and to share how it impacted them in caregiving, as well as the relationships with grandchildren and family members, which actually turned into his motivation to quit smoking. We have several other new participants this year. We engaged and are currently in a media buy, and I'll also talk about our website resources as well as our partnerships. So here's some more details. If you're not familiar with our campaign, the three major messages are that smoking causes immediate damage to your body. It leads to long-term health problems. The thing that I just mentioned, that for every one person who dies because of smoking, there are at least 30 people that live with a serious smoking-related illness, and that now is the time to quit smoking. And the free help is available, and then we always include a phone number. We have it in multiple languages, but here's the English one, 1-800-QUIT-NOW. All right, so the media buy for 2019 began on April the 1st, and it runs through October the 6th. There has been a major national TV and digital buy, both on broadcast as well as cable. We have also secured local placements in markets that experience higher smoking prevalence. And then we have a major targeted outreach. For example, the tribal media activity for 2019 looks like this. We are in health clinics. Good Health TV is who we partner with, and we're in nearly 30 states and just under 200 clinics. And if you're not familiar with it, basically we have about 6 of our different commercials that are airing while people are in the waiting room, as well as some of our longer form plays, which is more deep into telling their stories. And we have a wonderful partnership with Good Health TV. We're also in a number of magazines and newspapers, as well as national radio, local radio, and then digital media. We partnered with the National Native Network to make selections that we felt would have the broadest reach for our tribal populations. As I mentioned before, we love working with Good Health TV, and these are all of the states and locations where we're at. They have a specific long page on their website, but it's pretty much widespread. All right, so a lot of what we do beyond the national TV buy is provide numerous resources on our website, which is just www.cdc.gov/tips. And for any of those that are working with tribal populations that speak in Spanish, most of the website is also mirrored in Spanish. We have updated our cessation content, had a fresh new look. We have added vignettes or longer stories. We love for our participants to share their stories, and have added those, as well as published articles and numerous partner resources. All right, one page that you all might be really interested in is the healthcare provider page. So in anticipation of the TIPS campaign and 2019 being hailed as the year of cessation, we've updated our healthcare provider page to highlight our cessation materials and our clinical resources. So the healthcare provider page can be found under the partner page of the TIPS website. You would just go to the same one, www.cdc.gov/tips, but add HCP. And some of the updates to this page include a one-page layout. We condensed most of our specific healthcare pages to make our content easily accessible for healthcare providers to grab resources quick and easy. Also, easier access to tools. We've organized and added more resources to better meet the needs of our healthcare providers and partners, and clinical tools section with cessation resources and information. So we hope it's one-stop shopping for you all. We also point people to our free materials and our downloadable materials. There's two major sources where people can grab tips, information, and tips resources and use it that go beyond the website. So the website is where you can learn more about the participants and learn more about resources that you can use as a provider. On the left-hand side of the screen, you'll see the download center. I call this the DIY because so many people just want to be able to click, add it to their basket, and download. Basically, these are free materials that are low-resolution TV. So a lot of times you can use that in pharmacies or clinics, or a lot of, that doesn't require broadcast quality, but a lot of our partners use our low resolution TV ads, and they just scoop them up right from the download center. Radio, online, print, out of home ads, and public service announcements, they're all right there. So basically, I've included the download center right there. And when you go to the download center, you can basically click on the top and on the side, and you can download them to your basket, and they are ready to rock and roll. On the right-hand side of the screen, I'm featuring the Media Campaign Resource Center. It's a great tool, especially for those who are wanting to do paid placement. So we're talking about broadcast quality tips ads, and then other tobacco counter marketing ads for paid campaigns. It's also where if you want to take off the CDC logo and add your own logo in a taggable space with your own phone number or web page, you would go to the MCRC. So those are our two ways to get our downloadable materials. Here are some practical ways that you can support this year's campaign. You are welcome to include tips in your earned media efforts. If you have a newsletter or a listserv or anything where you would like to feature us, you're welcome to. We have lots of material on the website where you can just grab and go, or you're welcome to ask me for specific recommendations. I'd be happy to point you in the right direction. You can also highlight the impact of the TIPS campaign on your website or in other materials. As Mike mentioned at the start, we've had over 9 million quit attempts and over 500,000 sustainable quits since 2015. And we're continuing to update our data as we do more and more studies and publishing. You can also syndicate tips content on your organization's website. If you would like to do this, I can send you specific instructions, but basically what happens, and we call it R&D. You're able to rip off and duplicate our exact page and information. When you do content syndication, anytime we change facts and figures or add new resources, it automatically populates to your page. It makes it easy because we know so many of you wear multiple hats, so content syndication is your friend. Also, we'd like to ask you to engage the healthcare community and let them know about all of our free resources that are found. We've been able to help so many in not only IHS, but other tribal healthcare organizations, pharmacists, providers, community health workers. So just spreading that word for us. And then finally, share the ways that you've successfully leveraged tips with your colleagues. And we'd love for you to share with us what's been working for you and how you've been using tips. It's a great way for us to circle back and let people know at CDC, even at the highest levels, how it's making an impact. All right, so you can follow our campaign and support us via social media, which I'm going to move now into some of the ways that we do social media. But our whole campaign is called CDC Tobacco Free. Remember, commercial, not traditional. But we have lots of different badges. We have all sorts of hallmarks that people use. Like, for example, there's some badges that people can add to their picture profile pic to talk about that they've been 1 week Smoke-Free, they've been a month, they've been a year. It's kind of like a sobriety coin, but we do it to help people with their hallmarks of badges of honor of moving forward in their quit journey. So we have lots of ways to reach us on social media, from Twitter to Facebook, YouTube to Pinterest. We even have Snapchat and Instagram. So there are all of our platforms there. Let me talk about why we use social media and how we use it. So we primarily are using Facebook, YouTube, Instagram, and Twitter as our main platforms, and we currently have over 179,000 followers. So we have a robust collection of images and post content. And remember how I said before that I know a lot of you are wearing a lot of hats. We will allow you to take our actual images and grab them from our social media image library, and you can literally take them with the CDC logo off, add your logo, and it's like you created the social content. We have thousands of images that you can browse. A lot of them are native friendly. We have done several photo shoots where we've tried to include native from lots of different tribal populations, but our CDC MCRC, which is our Media Campaign Resource Center, has that social media library with images for you to use. We'd love to have tribal organizations using and adapting these images and just being able to have one less thing on your plate. So contact us to get registered to use these, and you can add your own logos and custom tagging, mcrc@cdc.gov. Underutilized, guys. If you want to get materials that are all ready to go, I suggest you check it out. All right, another thing that we have highlighted in 2019 for our year of cessation is QUITLINE videos. So we now have on our website 6 videos that describe what happens when someone calls a quit line. You know, a lot of the time we talk about why to quit. These videos actually talk about how to quit and what happens in the interaction with a QUITLINE service provider. There are lots of resources available for quitting, including the Quit Start app, social support, the Smokefree.TXT program that Alberta featured, and sample quit plans. But we have a great webpage that I've listed on the bottom of this slide that shows all 6 of the videos, as well as all of the different types of cessation support that we offer right from our website as like a launching pad to all the various ways to quit. A lot of people are getting on the Quit Start app because we've become such a mobile society and getting those notifications right from your phone. But we acknowledge there's numerous ways for folks to get help for their family members or themselves. And our QUITLINE videos happen to be something that has kind of demystified the process and made it a little less scary. All right, before I end, I wanted to mention that we are doing more and more to stay on top of the shift that's happened over the last several years, moving from combustible to e-cigarette and vaping. And we're especially concerned about the rise in e-cigarette use among our youth. And I'm sure you all are with your tribal populations. And so we have been engaging in a project this spring and this summer to develop a series of communication activities. Our goal is to educate parents, educators, healthcare providers about the risk of e-cigarette use among our youth. So we have numerous things available. We have a partner toolkit. It includes public service announcements, a press release, sample newsletters, and articles that you guys can just lift and use and personalize. We have PowerPoint presentations that talk about the risk of e-cigarettes for youth and adults, and we actually have one specifically for people to go in and talk to young people. I've seen it. It's fantastic. It's available for your use. Fact sheets. We have infographics and fact sheets that target parents, that target teachers, and healthcare providers. And they're awesome. We even have them in Spanish. And social media, we have a lot of posts and sample content and images that are available for free for you all to use. So all of that is available when you go to cdc.gov/tobacco. Then it says basic_information, and then e-cigarettes. It'll go to the index, and it has all of our e-cigarette information. So we are ready and willing to help you with a lot of free resources at CDC. We are so grateful that we get to work with our populations. And so one of the things that I wanted to mention are key takeaways. This is the part where if you have fallen asleep, you can figure out exactly what I said in one slide. So here we go. We have a number of campaigns and resources available free to support you in your efforts. We'd love to work with you to adapt any messaging for use in your community. I wanted to mention that we're not big into direct translations, but we love working with language keepers. And CDC just went through a major email update system. So if anybody has emailed me recently about adaptations, email me again at mjohns@cdc.gov. We would love to work to create adaptations. We have several tribes that are interested in adapting the tips from former smokers, posters, and prints to work for in their tribal languages for their tribal organizational use. So not just tips, but other things. If you're interested in adapting some of the e-cigarettes or QUITLINE information, just let us know and we will start to work with you. We definitely offer adaptations and make sure that things are culturally relevant. That is what I do pretty much all day, every day at CDC. So I would love to have a strategy session with you to discuss what that might look like. You can contact me directly or go to our OSHCOMTA at cdc.gov to get started. All right, so that's my presentation, and I will turn it back over to Mike. He will instruct us how to handle question time. And I thank you guys for the opportunity to share some of the latest information about our communication initiatives.
Thank you very much, Michelle, and thank you again to Alberta for presenting. If you have any questions that you'd like to ask the presenters, feel free to type them into the box labeled questions, and we'll go ahead and do a little bit of a Q&A session here up until the top of the hour to respect everybody's time. The first question that has come in, I think they're looking for maybe just a reminder on what is the website where they can get the infographics. Are they free? Is the texting service available nationwide, or is it just for your state?
I'll go ahead and start, Mike, and then I'll turn it over to Alberta for about the texting. So
Sure.
All of our resources are free, and we have this available. I think it's going to come into a handout. So if you'll look in the handout queue, you can grab that and it will show you all of the links to our websites where we have all the resources. But if all else fails, email me at mjohns@cdc.gov and I will just send you the hyperlink. And of course, our infographics are reproducible. They have been cleared by the CDC. They're in beautiful coloring. As long as you feel like it is culturally relevant, you can just snap up and grab those. If you think that there's something that needs to be adapted or tweaked, please let me know and we can work with the science team to make sure that we keep the science there, but it stays culturally relevant. So that's about the infographics. Alberta, would you like to address the texting program?
Sure. Once the smoke-free text messaging rolls out from IHS, it can be used throughout the nation. So what is also going to be developed along with the smoke-free text messaging will be also some posters that can be downloaded and placed in the clinics and tribal colleges or in the community, so people will be informed of that these services are available. And then as far as the infographics and posters and digital stories, that will be placed at the IHS Health Promotion Disease Prevention website. So you'll be able to download and print, and you'll also be able to download the digital stories to use with in your communities as well.
Fantastic. And then I think that might have answered the next question too, asking if they're available in Arizona.
It will definitely be available all over the nation.
Great. Somebody says here, a question for Michelle. Is there a fee to get on with Good Health TV services? If so, how much does it cost?
Yes, we had to pay, but it was very little. Like cost per GRP was extremely affordable, and we worked with the owners at Good Health TV. They are fantastic to work with, but there is a nominal fee, and I'm not exactly sure what it is. I'd have to look, but it was ridiculously inexpensive compared to like putting something out on TV. But I know that they have the best reputation in Indian country for being like the most watched in health clinics. So we have loved working with them. We tripled our investment with them this year because they gave us so much value last year when we placed with them. We tripled our investment. So it's a good buy, very inexpensive, and we loved working with them. They gave us great metrics with great results of impact of how many eyes we're watching, how many times a day. So I can't say enough good things. We loved working with Good Health TV.
This next person says, is there an Instagram account called CDC Tobacco Free, or just the regular CDC account? She says that you can't find one called CDC Tobacco Free.
I'm pretty sure if it's not, it's in the works. We may be using the CDC account for now, but we've had some recent Instagram stories featuring our tips from former smokers. So I'll have to get back to you on that. If you'll email me, I can answer that probably within an hour of this presentation. My guess is we're newer to Instagram. There's a lot of rules at CDC. If you're not finding us at CDC Tobacco Free, we're probably still on the CDC main site. But I think our goal has been, yes, to do tobacco free for all of those various platforms.
This next person says, can you explain in a bit more detail the relationship between tobacco and diabetes?
Sure. There is actually research studies that supports that people who use commercial tobacco product are actually at increased risk of for diabetes. And let's see, let me hang on one second. And so people who are using commercial tobacco product are, are less likely to be able to go control their diabetes as a result of hang on one second. They're more likely to have trouble with the insulin dosing and controlling their diabetes. So no matter what type of diabetes a person has, smoking actually makes it harder, because smokers with diabetes, they get a higher risk for serious complications that may include heart and kidney disease, and then they have poor blood flow in the legs and feet, which can actually increase their risk to infections and ulcers and possible amputation. And that also affects more serious risk for retinopathy, and then also neuropathy, which is damage to the nerves and may cause numbness and pain and weaknesses and poor coordination. So but when they looked at people who have quit tobacco use, they actually they have better control of their blood sugar levels.
Okay. This next person asks, does IHS have any stats on e-cigarette usage among Southwest tribes?
The usage of commercial tobacco?
I think e-cigarette, electronic cigarette, like vaping.
There is some e-cigarette use among different tribes, but I have not seen a national or regionalized data on e-cigarette use. I know that there is some, I guess, not study, but actually projects that are in motion that are collecting information on the e-cigarette use among American Indian, Alaska Native population, and will be printed maybe in a year or maybe in 2. And then you may also want to go check with your tribal epicenters, because the tribal epicenters conduct youth behavioral risk survey and adults behavioral risk survey. So they're able to go have more localized, regionalized data among, because they ask about e-cigarette use on their surveys. So, but I have not seen I guess, a national or even regionalized e-cigarette use data. Maybe Michelle may know.
I think we're still working on it.
Okay. This person says that Michelle has shown a U.S. map with different colors and dots where some resources were in different states. Why different colors for states? Are more states going to receive services? I think that's the Good Health
That was
TV
just Good
map.
Health TV, yeah. So that was the map from the Good Health TV webpage, just showing where they're located. I'm not sure that the colors are that significant. It may have to do with the epicenter regional locations, but I grabbed that right off of their page just to show where we're on throughout. Wherever they're on, we're on. So it's 192 clinics in 29 states, and it's growing all the time.
Yeah, it's basically a coverage map for Good Health TV. So, and then this other person had asked if I think if Alberta could share the studies on the relationship between tobacco and diabetes, and I would recommend probably emailing Alberta, and she might be able to help you out a little bit further as far as that goes. So, let's see here. We've got about 8 minutes left. If anybody has any extra questions, feel free to type them into the question box. Again, we will be archiving this webinar on our website at keepitsacred.org. So feel free to follow us on social media, Facebook, Twitter, LinkedIn, Instagram, and we'll have an archive of the webinar on our website with the resources, or just the plain old video. We'll also place in our YouTube channel as well. So just look up National Native Network in YouTube, and it should be available there also. With that, I'm not really seeing any more questions pop up. Did Alberta or Michelle have any other comments to add?
This is Alberta. Just FYI, I plan to work with the Good Health TV to be able to go load some of those of the American Indian men and women who have successfully quit, to be able to reach the population at next, who are waiting in the lobby for their appointment. So we'll be able to do a broad reach.
Okay. And then Michelle, did you have anything that you wanted to add at all?
No, thank you so much for this opportunity, and we are here and available to help. I think we just wanted to mainly highlight free resources that are available to help you in any capacity that we can. Thanks so much for the opportunity.
Excellent. And again, feel free to follow us on social media and visit our website. We should have the archive going out here within the hour. And also, you should be receiving a post-webinar evaluation link as well. So if you could kindly fill out the evaluation, let us know how we did. We'll go ahead and send in the information for everybody that filled it out, so that everybody can get continuing education units for it. So again, thank you very much for attending our webinar today, and I hope you have yourself a wonderful day.